everyone, I'm Kirti from Kirti Institute, and on your request, I'm back to explain on OET Reading Part B. OET Reading Part B and C are taken as a combined section. In total, you will have 22 questions and 45 minutes. That means you can spend ideally 2 minutes per question. In Reading Part B, you will have 6 questions with 3 answer options. For each of the question, you will have separate box of information. The type of communication is like a workplace communication, practical communication, such as staff updates, policy documents, guidelines, manuals, patient information leaflets, memos, and emails. This part assesses your ability to read in detail and your ability to comprehend the task. There are mainly 3 types of questions. Number 1 is finding the purpose. You have given the text and you are asked to find out the purpose of the writer to make this text. So you cannot find the literally printed option from the given answer options. It is assessing your ability to find the purpose. That means you have to read the whole text and you need to think that why this text is given. Number 2 is finding the gist. Finding the gist is also about the overall meaning of the text. In order to improve your skills on these 2 types of questions, like finding the purpose or finding the gist, you can ask yourself WH questions. You can take any text about the medical conditions, and in order to improve your basic skills to identify the purpose or gist, you can read one paragraph and you can ask yourself WH questions. What, when, why, how, and where. You may not find all the answers, but based on this, you have whatever information is given in the text. Based on that, whichever answers you have received, based on that, you have to make a summary. That means after reading one paragraph, you have to ask WH question to yourself, and based on your understanding or the answers you have received from the text, you have to make one sentence, and that will be the summary of the whole text. Okay, and based on your summary, you can select one option. However, on the third type of question, that is finding the main point, this is about finding the specific information from the given text. Okay, something is asked from the text itself. So for this third type of question, you can show me that this is the sentence because of which I believe that A is the answer. Okay, so you can show me the location for the direct question. So in my point of view, there are 3 questions, 3 types of questions: purpose, gist, and the main idea, that is the main specific information that is being asked from the question. Let us see more in detail from this practice session. I hope it's visible to all of you. All right, let us see. The first question of this text is literally for the purpose kind of question. You will have clearly mentioned what is the purpose of the memo, what is the purpose of the given information. Okay, so this has very specific information, very specific question that you can clearly identify that this is asking about the purpose. Okay, if you think about the memos or the information like what the manual informs, or the notice is giving information about what the memo is doing. Okay, so this kind of questions are about finding the gist. And as I said, third kind of question is something asked from the given text. Let us see each one of the question in detail. Number 1 is the purpose of the memo about IV solution bags is to remind health practitioners. So which are my keywords are purpose, for what, about IV solution bags, okay, to remind health practitioners what. This is the incomplete sentence that you need to complete. Now, after reading the question, you have to read the text. Okay, many of the students feel it comfortable to read the text first, then read the question and answer options. It's totally up to you. You have to try each of the method, like reading the question first, then reading the paragraph, then reading all three options, eliminating the wrong option, and finding out your final answer. Okay, the correct option. So this is one ideal method to do. Okay, so I have gone through the question. Now I will go through the text. Now the text says memo to staff, intravenous solution bag. That means this is question asking about the purpose of memo to staff. So if you will see here, the paraphrased information you can find, okay, to remind health practitioners. So memo to staff, that is health practitioners, about intravenous solution bags. So here you can see IV solution bags. So what is the purpose for giving this memo? So let us read. IV fluids are administered via a plastic IV solution bag which collapses on itself as it empties. That you all know, okay, it collapses, sinks by itself when it empties. When a bag is disconnected, by removing the giving set spike, air can enter the bag. If it is then reconnected to an IV line, air can potentially enter the patient's vein and cause an air embolism. Okay, so what here up to now I understood is, if we remove the IV spike set and if I respike it, there are chances that the air can enter the patient's vein and cause air embolism. For this reason, partially used IV bags must never be respiked. All IV bags are designed for single use only, for use in one patient and on one occasion only. All registered large volume injections, including IV bags, are required to have this warning or words to the same effect clearly displayed on the labeling. In addition to the potential risk of introducing an air embolus, respiking can also result in contamination of fluid, which may lead to infection and bacteremia. So what I understood from this whole memo is that if we are using IV solution bag and if we are respiking the IV set, the air can potentially enter into the patient's vein and causes air embolism or other complications. This is what I understood from the given text. Now I will read A, B, and C. Option A says of the procedures to follow when using them. Okay, so option A says about something about the procedures. Okay, number 2 says of the hazards associated with faulty ones. Okay, so not only hazards but associated with faulty ones. So this is another keyword. Why they shouldn't be reused. Okay, so option C says why shouldn't be reused. Okay, these are my keywords. Now let us try. Option A says procedures. So whether they mention about the steps of procedures to administer IV fluids or intravenous solution. No, it is not about the procedure. Hazards, yes, hazards are there. But is these hazards are related to the faulty bags? Have you read anywhere about the faulty ones? No. So this answer also I need to remove. Number C, option C says why they shouldn't be reused. So here, throughout the text, I have many reasons why I shouldn't reuse the IV bags. Okay. So here I can see that the air enters into the patient's vein and causes air embolism. Okay, this is the first reason. Another reason is that it can contaminate the fluids, which may lead to infection and bacteremia. Even if you are reading the text, the whole text, the language of the text is a little bit tricky, but still it is easy to find the answer if you think consciously. Okay, it is not about the procedures. It is definitely about the hazard. The procedure is not given. Hazard is there, but it is not about the faulty ones. Okay, so half of the option is matching, another half is giving the contrast information. So this is not the answer. And C is literally matching with our option. So For the purpose kind of question, you may have the scattered information about the memo or about the heading, and you need to find the purpose of the given text. Okay. Let us see another type of question, that is, let us see what kind of question it is. What do we learn about the use of tense machines? The question itself is asking us what we learn. It is about what we learn. So what I learn cannot be given into the text, right? I need to think by myself what I am learning while reading the text, after reading the text. So it is, your answer is based on your learning, your thinking, and your ability to comprehend the text. And that is why it is about the finding the gist, finding the overall meaning of the text. And as I already mentioned, you have to ask yourself WH questions to find the overall meaning if you are not confident to find out the answers of this kind of question. Let us see. Update on tense machines. The Association of Chartered Physiotherapists in Women's Health has an expert panel which could not find any reports suggesting that negative effects are produced when TENS has been used during pregnancy. However, in clinical practice, TENS is not the first treatment of choice. It is not the first treatment of choice. So before that, what the writer said, it is safe, right? Expert panel could not find any report suggesting that negative effects are produced. So there are no any negative effects. That is what initially said by the writer. Okay, I would also like to underline or highlight not, so that I can understand. Okay, now if I'm reading further, still this says it is not the first line treatment. The initial treatment should be aimed at correcting any joint or muscle dysfunction. So first priority should be about correcting the dysfunction. Okay, and a rehabilitation program should be devised. However, if pain remains a significant factor, the TENS is preferable to use of strong medication that could cross the placental barrier and affect the fetus. No negative effects have been reported following the use of this modality during any of the stages of pregnancy. Therefore, TENS is preferable for the relief of pain. So, on one hand, I'm finding all the positives of using TENS machine on pregnant lady. Lastly, they says that there are no complications, no negative effects have been reported, so it is safe. However, initially the writer said that it should not be the first choice of treatment. That we should keep in mind. And now let's see the options A, B, and C, which suits best for this question. What do you learn about the use of TENS machine? Evidence for their efficacy is unconfirmed. Do you believe that? They have given a lot of evidences, right? And they have also said that the report says that it is safe. So is it about unconfirmed? I don't think so. B says they are recommended in certain circumstances. Certain circumstances, I can say, okay, because here certain circumstances, like if this first line of treatment fails, okay, your aim should be correcting any joint or muscle dysfunction, and then rehabilitation program should be there. Despite giving all these corrections and rehabilitation program, if the pain persists, in that situation only TENS machines should be used. Okay, so in that circumstances where the initial treatment fails, the TENS machine should be used. So in my point of view, certain circumstances suits best. However, I will not finalize the answer unless and until I read the third option and will make sure that this is not the correct option. Okay, so let's move to option C. More research is needed on their possible side effects. So is there anything like that? Possible side effects, whether the writer said that more research should be carried out. No, I didn't find this information. So C is not the option. Okay, so again, I'm explaining you the method for finding the purpose or finding the gist or any kind of question. First of all, you will have to read the question. Read the text, then read the options, remove the wrong answers, eliminate the wrong options, and finalize your correct answer. Okay, for first two questions which we have seen, is first is about the purpose and second was about the finding the gist. Both are about finding the overall meaning of the text. This requires our comprehension and detailed reading. Okay, we have not skimmed and scanned for this part. We are reading in detail and trying to think on it. Okay, what the writer exactly wants to convey through this text. Now let us see third question. This is, if surgical instruments have been used on a patient suspected of having prion disease, they should be done what? Okay, if we are using surgical instruments on the patient diagnosed with prion disease or suspected to have prion disease, what should be done with those instruments? Okay, so my question is, surgical instruments used on the patient with prion disease. So it is important to underline or highlight the keywords. Now I will move to the text. As I said, guidelines, invasive clinical procedures in patients with suspected prion disease. It is essential that patients suspected of suffering from prion disease are identified prior to any surgical procedure. This is my direct question. So what I'll do, I will wait for what should be done if the instrument is used. So once I will get the information where it shows that the instrument have been used, then I will read carefully to understand, to get my answer. Okay, so this says that we should identify the patient before the procedure. Failure to do so may result in exposure of individuals on whom any surgical equipment is subsequently used. So if in case we are using on another patient, we are exposing the patient or individual with the infection of prion disease. Prions are inherently resistant to commonly used disinfectants and methods of sterilization. Resistant, that means it does not give any effect to any kind of decontamination method, okay, method of sterilization. Okay, commonly used, so it gives no effect on the instruments if it is contaminated with prion. This means that there is a possibility of transmission of prion disease to other patients even after apparently effective method of decontamination or sterilization have been used. So ultimately it shows that there is no effect even if we are using effective method of sterilization. Right, so this is my another sentence. For this reason, now my answer is connected. Okay, for this reason is my keyword that I need to get alert that okay, now my answer may arrive. For this reason, it may be necessary to destroy instruments. So this might be my possible answer. What should I do? I should destroy the instruments after use on such a patient, or to quarantine, or now here it is, or sorry for delay, to destroy instruments. On one hand, it says that it may be necessary to destroy instruments after use on such a patient, or to quarantine. Now you know very well the meaning of quarantine, right? To keep it separate, the instrument until the diagnosis is either confirmed. So this is about prion disease. Okay, once it should be quarantined, kept separately until the prion disease is confirmed. Okay, the final diagnosis is made as prion disease, or an alternative diagnosis is established, or another diagnosis is made. Till then, we have to keep the instruments quarantined. In any case, the instruments can be used for the same patient on another occasion if necessary. On the same patient on another occasion, we may use the instruments. Now let us see. Yes, I understand that it is the trickiest language, right? It is not that easy to understand. But if you read thoroughly, if you try to understand in detail with the conscious mind, you will be able to understand the meaning, the overall meaning of the text and your possible answer. So for this kind of question where it is like a direct question, you can show me the location. Okay, like, ma'am, this is the sentence because of which I feel that A, B, C, anyone is correct option. Let us see how. Must be routinely destroyed as they cannot be reused. Okay, we just read the final sentence that says the instrument can be used for the same patient on another occasion. So this is giving contrast information. It is not like we cannot reuse. We can reuse on same patient on another occasion. So it is not the case that we have to routinely destroy. We should also keep it quarantined. Okay, so A is not our answer. Now let us move to B. May be used on other patients provided the condition has been ruled out. This is the answer, correct answer, but how? I will let you know. Let's read the C first. Should be decontaminated in a particular way before use with other patients. However, if we will read the text, it is clearly mentioned that it is resistant to commonly used disinfectants or method of sterilization. Further, the writer has explained that even after apparently effective method of decontamination or sterilization have been used, okay, it cannot be disinfected. Okay, there is a possibility of transmission of prion disease. Okay, even if we use the most effective method of sterilization, it is resistant, it does not work. Okay, so C is also not our option. So we are quite sure that A and C are not our options. Let us understand why B is the option. Here they said that may be used on other patients provided means if, in this condition, if the condition has been ruled out. Now, what is the meaning of ruled out? Many of the students take the meaning exactly opposite than the actual meaning. Okay, it is to rule out means to exclude, to eliminate, to remove. Okay, but many students take it as a confirmed. Okay, the diagnosis is ruled out. That means cancelled, that is excluded. Okay, like in your writing case notes also, if you find that diagnosis pneumonia, in bracket they have written like ruled out. That means that pneumonia is excluded, pneumonia is not the diagnosis, some other diagnosis can be there. Okay, but the meaning of ruled out is to exclude, to eliminate. So here now you read the option and try to understand. May be used on the patients if the condition has been ruled out. If the condition has been ruled out means another diagnosis is made, then we can use the instruments on other patients. Okay, here they have mentioned that for this reason, it may be necessary to destroy instruments after use on such a patient, or to quarantine the instrument until the diagnosis is either confirmed, that means prion disease is confirmed, or an alternative diagnosis is established, that means other diagnosis is established. So if other diagnosis is established, in that case, you can use these instruments on other patients as well. Right? And based on this understanding, B is our option. I know this was a trickiest one, but if you're practicing, if you are trying to understand the type of question, how to locate the answer and how to find the answer first of all, and from where to find the answer, how to find the keywords, I hope you will come closer to the correct answer, right? So you please apply this method and I hope it will definitely work for you. Before leaving, I would like to just go through the questions. The email suggests that POCT devices. So here the subject of the email is management of point of care testing devices. So this is about email suggests. So suggest is about finding the gist, finding the overall meaning of the text. If we will see, the next question is, it's permissible to locate a baby's identification band somewhere other than the ankles when. So under which circumstances baby's ID band can be tied up somewhere else than the ankle? So this is a direct question. You can find somewhere hidden answer and you can show me the location. This is the sentence why I feel that A, B or C is the correct answer. Okay, but for fourth question and now for the sixth question, you cannot show me the location. What is the memo doing? Okay, very simple question. What is the memo doing? So definitely the question itself helps you to understand that you need to understand the whole paragraph, and based on your understanding, your summary, you are going to select one option. So if you're trying to find out like the paraphrased meaning of this option A, B, or C, you will never find the answer in that manner for gist or purpose. Okay, whereas you may find the paraphrased information of any one of the options for the direct question. Okay, so with this understanding, I'm now leaving this meeting. I hope you understood about the text about reading part B, some tips and techniques. I hope this will definitely work for you. And if it is so, please write into the comment box and I would be happy to help you with reading part C. Thank you so much for now. If you really like this video, please like, share, and subscribe. And see you in the next meeting. Bye-bye.